Dr. Mobley here. We've done an endoscopic brow lift. We're going to go through the dressing removal, and probably one of the more important things on the brow is how to reapply the dressing. So I'm going to show you all that in this video. Like so many of the dressings we use, whether it's ear pinning or what have you, we use these elastic kind of tubular dressings. If you just keep cutting on them, they'll eventually kind of pop off. Just got to make a complete circle and they'll release. I'm going to just come down here, just keep it private a little bit. So the whole dressing comes off. Now this happens sometimes, the reality of just medical care. I want this dressing here to be a little bit lower. You can almost see where the skin's got those little depression marks on it. So the dressing's kind of started to pop off a little bit. We're 2 days after surgery, that's no problem. But when we reapply the dressing, we really want the dressing to be right there at the hairline. So I'm going to finish taking this off. So with the dressing off now, of course the hair is very matted, that's pretty normal. Remember an endoscopic brow lift, if you look kind of just in the hair, you can see a little bit of those little staple clips there. A few over here. Those are placed so you don't have to shave any hair, so when those come out, there's incisions almost becomes invisible because the clips can be placed right in here without having to shave any hair. Typically there's 3 sets. You've kind of got one in the center, one that's going to be kind of in line with almost your pupil down below but up high at the hairline, and then off to the left. So 3 total, 1, 2, and 3. There's not a lot to do to these. We will encourage you maybe when I tell you it's okay a couple days after the procedure to go home and do a good shampoo. Your hair is really matted from surgery and having that dressing on. Today we're just going to work on putting the dressing back on. In the endoscopic brow lift, right around the hairline in these 3 positions, just in front of the staples, one there, one there, one there, are those special little medical scalp tacks that are the whole mechanical way that keeps the brow up. So we want our dressing to kind of be firm against that area so that we're encouraging those tacks to do their job to support the forehead in its new lifted position. And I'll show you. So putting on this dressing just as it has some mechanical details to it. In the medical field, the bottom of your scalp, the skull, that's called the occiput. And so you really want this dressing to be just under the occiput. That's the natural little overhang of the underside of our skull. And that is a good anchor point so the dressing doesn't pop off the top of your head. So we want to kind of wrap it there and then come right across that important top part of the forehead. And you just need a layer to it. This Coban's very sticky. And so we're applying pressure underneath the dressing. That's basically right at the hairline. That's where those critical little medical tacks are. But because back here, we're low and under the occiput, that's going to keep the dressing from sort of popping off the top of your head. And you can apply this sort of once a day. You could shower, but when you come out of the shower, we want you to reapply this so we're keeping good pressure until you're about 1 week post-operative. Now again, we're going to let patients know that it's okay to shampoo your hair after an endoscopic brow lift, but do keep some of the mechanics in mind that the scalp skin does attach from below, if you will, to those little tacks. So when you go to shampoo your hair, just very gentle along the hairline. It would take a lot of effort. Most people would not do it. But if you were extremely aggressive on your scalp, in theory, you could almost knock the scalp off of the tack. Now, I've never seen that happen, but I guess it's a theoretical risk. So, okay to shampoo, just do it very gingerly, particularly where the scalp skin kind of meets your hairline. Just remember, that's where all the critical, shall we say, the critical hardware is in that area, so don't be too aggressive in that spot.